Welcome. Today, we're going to talk about something that touches almost all of our lives, but that we rarely talk about out loud: intimacy. With a little help from the experts at the Women's Health Clinic, we're going to pull back the curtain on psychosexual therapy and show you how it can be a real, structured path to, well, reclaiming that part of your life. So let's just start with a really honest question. Have you ever found yourself wondering this? Why something that's meant to feel good, to bring you closer, can sometimes end up feeling painful or just distant? Or maybe it just feels like another thing on your to-do list. If any of that sounds familiar, the first thing I want you to hear, and I mean really hear, is this: you are so not alone. These feelings are incredibly common, and just asking the question is a huge first step. Okay, so to really unpack a topic like this, you need a guide you can trust. So let's introduce the specialist whose clinical work is really the backbone of everything we're talking about today. Our guide is Dr. Farzana Khan. Her entire focus at the Women's Health Clinic is on giving people clear, compassionate answers, which honestly makes her the perfect person to walk us through this. And she's got the experience to back it up. We're talking over 20 years as a doctor, with a medical degree from the University of Copenhagen and specialized diplomas in sexual and reproductive health. So, long story short, we're in really good hands here. All right, let's get to the heart of it. What is psychosexual therapy? It's one of those terms that gets thrown around, but what does it actually mean? What really happens? So at its core, it's a kind of specialized talking therapy. But here's what's so important. The focus isn't just on the physical side of things. It's all about understanding that powerful link between our brain, our feelings, and our relationships, and how all of that plays out in our sex lives. Now, to really get how this works, we have to bust a huge myth first. You know the one we see in every movie, that desire is supposed to just hit you out of nowhere like a lightning bolt. Well, let's talk about the reality. This is so fascinating. It turns out there are two main types of desire. There's that Hollywood version, spontaneous desire. But then there's responsive desire, which is just as normal, just as healthy. This is where desire actually kicks in after you start becoming physically aroused. You might not be in the mood at all, but through touch and connection, your brain catches up. For so many women, especially in long-term relationships, learning this is a total game changer. It's not a problem to be fixed. It's just how your body works. Okay, let's talk about one of the biggest mood killers out there: anxiety. It often shows up as something called spectatoring. Have you ever felt this? It's like you're not actually in your body enjoying the moment. Instead, your brain is sort of hovering near the ceiling, watching yourself, worrying about how you look, if you're doing it right, if it's taking too long. It just completely pulls you out of the experience. So how on earth do you stop doing that? Well, there's a clinical technique for it called sensate focus. And it starts with a pretty wild first step.
You ban intercourse.
Yep. Take it completely off the table. Why? Because it instantly removes all the pressure to perform. The goal isn't orgasm anymore. The goal is just to feel. You do these structured touching exercises that are all about reconnecting your brain with your body. And that brings us to a really important point. This kind of therapy is so much more than just talking about your feelings. It's a structured, proven process that tackles some very real and very valid issues. This might be the biggest, most damaging myth there is. It's the fear that if you need a psychotherapy, then your pain isn't real, that you're just making it up, or that it's some kind of personal weakness. But the reality is much more complex, and it has a name: the biopsychosocial model. It shows how everything is connected. It might start with a real biological problem, like dryness after having a baby. That physical pain then creates a psychological fear. Your brain basically creates a fear memory. That fear makes you anxious and tense, which can make the pain worse. And of course, that whole cycle puts a strain on the social part, your relationship. Therapy doesn't say the pain is in your head. It helps you untangle the fear that's gotten wrapped around that very real pain. And let's be crystal clear about something that is absolutely critical for safety and trust. This is a no-touch therapy. This quote from the Women's Health Clinic says it all. The therapist will never, ever touch you. Any physical exams are done by your doctor. The therapy itself is strictly about talking, learning, and working through things in a safe space. So who is this actually for? Well, it's for anyone who's dealing with a whole range of things. Maybe it's persistent pain during sex, or maybe it's a loss of desire, or finding it hard to reach orgasm. It's also for people who find themselves just avoiding intimacy altogether because of fear or shame. It can also help with challenges that come from medical issues or past trauma. Basically, if sexual difficulties are causing strain in your life, this is a path that's designed for you. So, if you're thinking this might be right for you, what does that journey actually look like? Let's talk about the practical side of finding your way back to intimacy that feels good again. A typical session is usually about 50 minutes, maybe every week or two, and the number one priority is creating a safe, totally non-judgmental space. Like we said, no physical exams. The work is about talking, and then you get homework, practical exercises to try in the privacy of your own home. And it's all part of a team effort. Your therapist might work with your doctor or a physio to make sure you're getting complete care. And the great thing is, the work doesn't stop when you leave the session. There's so much you can do to support yourself on this journey. Simple things like learning more about your own body, making sure you're getting enough rest, and yep, there it is again, taking intercourse off the table for a while. It's all about giving yourself the space to heal without the pressure. So if there is one thing, one single thing you take away from all this, let it be this. These issues are common. They are not in any way a personal failing. And the best part? There is a real, structured, professional way to work through them. So we'll just leave you with this final thought. We tend to think intimacy is all about the physical. But what if the path back to real pleasure and connection doesn't actually start with a touch? What if it all starts with a new conversation? Thanks so much for watching.